Assalamu alaikum and hi. In today's video, we are going to discuss about difference between adverse effect and side effect of drugs, one of the most conceptual and confusing concept in pharmacology. So let's start the video. Definition: Adverse effect. Adverse effects, also known as adverse drug reaction (ADRs), refers to any harmful or unintended effect of a medication occurring at a dose used for treatment or prevention. These effects may be predictable or unpredictable and can range from mild to severe. While side effects are a subset of adverse effect and specifically refers to the unintended and usually predictable effect of medication. They are typically mild and occur at therapeutic dose but are not the intended therapeutic outcome of the drug. So, adverse effects is a broader term. Their intention might be unintended or may be intended, while side effect is a subset of adverse effect and usually unintended and they are predictable. Adverse effect may be predictable or unpredictable, but side effects are usually predictable. Predictability. Adverse effects may be predictable or unpredictable. Predictable adverse effects are those that are pharmacologically predictable based on the known mechanism of action of the drug or its clause. Unpredictable adverse effects are idiosyncratic reactions that are not related to the pharmacological action of the drug. Side effects are generally predictable based on the known pharmacology of the drug. Remember that the side effects are predictable, through which parameter we can predict through pharmacology of the drug. They often result from the intended pharmacological action of the drug but occur at dose lower than those needed for therapeutic effect. Adverse effect. Severity. Adverse effect can range from mild to severe. Severe adverse effect may result in significant harm to the patient and can sometimes be life threatening. While side effects are typically mild and transient in nature, they are usually not severe enough to warrant discontinuation of the medication and often resolves spontaneously or with supportive treatment. So we can compromise on side effect, but there will be no compromise on adverse effect. So severity of adverse effect is greater than side effect. Intended pharmacological action. Adverse effect may or may not be related to the intended pharmacological action of the drug. Very important concept to remember. They can result from interaction with off targeted receptor, metabolic pathway, or other physiological process. Side effects are directly related to the intended pharmacological action of the drug. They occur because the drug interacts with physiological system other than the target system for which it is intended. So very important to remember. Clinical significance. Adverse effect may have significant clinical implications requiring monitoring, dose adjustment, or discontinuation of the medication. Remember that in which case we need to discontinue our dosage or regime in the case of adverse effect. They can impact patient safety, treatment adherence, and overall therapeutic outcomes. Side effects are usually of less clinically significance compared to other adverse effects. While they may cause discomfort or inconvenience to the patient, they generally do not pose a significant risk to patient safety or require specific interventions. So these are the clinical significance of adverse effect and side effect. Examples: Adverse effects. Steven Johnson syndrome, a severe and potentially life threatening skin reaction, is an example of adverse effect associated with certain medication like sulfonamide is antimicrobial drug and anti-epileptic drugs like loperamide and many other classes. Side effect: drowsiness or sedation caused by antihistamines medication such as diphenhydramine is an example of side effect commonly experienced by patients taking these drugs. Remember that the anti-epileptic drug lamotrigine is the one having the adverse effect of SJ syndrome, while a side effect is common with many drugs like antihistamines. Summary. In summary, adverse effect and side effect are both unintended consequences of medication use, but they differ in predictability. Which one is predictable? You can say now. Severity, which one is more severe? Intended pharmacological action, which one is related to the intended pharmacological action and which one is not? And clinical significance. Adverse effect encompass a broader range of harmful effects, including both predictable and unpredictable reactions, while side effects are specifically refers to the predictable, usually mild effect of a medication. Understanding these differences is crucial for healthcare providers in managing medication therapy and minimizing harm to patients. So that's all. Thank you so much for your attention. If you're learning something valuable from this video, please give me a favor, like this video, subscribe this channel, and share this video with your friend. Thank you so much for watching.